another video, and I'm sorry for not posting recently. My family and I have gone on a trip, but I'm back again. And thank you for watching. Today we're going to be covering tests for all cancers, part 3. And right now the video is unavailable, so therefore we will watch on YouTube. We will watch for 1 minute.
You think
If this is your first time here, welcome to your friendly proctologist, and that's me, Dr. Albert Chow.
Because we will
If
be
this is not your
talking
first time,
about
I welcome
methods
you
of
again,
diagnosis for
and I
anal
hope you
cancer.
enjoy your stay.
And one way of diagnosing
I'd like
anal
to
cancer
talk
is
a
by
little
using
bit
an
about
anoscope,
anoscope.
an anoscope,
I referred to it
which
in
this
my previous
proctologist
videos,
will talk
and I
about.
wanted to demonstrate and show you the parts of that equipment and also the procedure in more detail. I've referred to it before when you want to have an evaluation done or examination to see what your problem is coming from. The anoscope can be very valuable in that. But at the same time, you want it to be preferably be done by someone who can do it correctly, which means without pain or much discomfort, and someone who can recognize or make a diagnosis based on that procedure. Logic says if someone's going to perform a procedure.
Yep. So now we will go back to our slideshow. Anal cancer. So, like the guy mentioned before, one way to detect anal cancer is through an anoscopy. Now, in an anoscopy, the doctor uses the hollow, short, and firm tube that goes by the name of an anoscope. And an anoscope is around 3 to 4 inches long and around 1 actually in terms of inch in terms of its diameter. And sometimes it will have a light at its end. Now the doctor coats the anoscope with a gel, and afterwards the doctor will push the tube into the anus and lower rectum. And shining the light into this tube will give us a clear view of the lining of the lower rectum and anus. And something about this procedure is that the patient will be awake during the procedure, but they will be administered local anesthesia, so there won't be any pain. And another method of diagnosing anal cancer is through a rigid proctostigmodoscopy, and it is a lot like an anoscope, except it's longer, around 10 inches long, and with this the doctor will be able to see the anus rectum and the lower parts of the sigmoid colon. However, the patient may need to take laxatives or have an enema before the procedure to ensure an empty bowel. And that is just an image of what anal cancer may look like. Now, moving forward, we have appendix cancer. Now, let's watch a video on how a colonoscopy works in diagnosing cancer, in which appendix cancer is included.
I'd like to show you exactly how a colonoscopy can help save your life. This looks like a normal colonoscopy, normal colon lining, until you see this small polyp. And this was found by my colleague at NYU Langone Health, Dr. Mark Pachapin. He pushes out a white catheter with a metal wire and lassos the base of the polyp nice and snugly, applies electricity, which cauterizes and cuts that polyp. It falls away from the lining of the colon.
There are also
and now
steps of
he's going to
treatment
push the instrument tip right up to it and apply suction, and the polyp will come right back through the instrument off to pathology, where it will be found to be benign. Now, had that polyp stayed in, it could have developed over time into this. This is a colon cancer. You can see it looks totally different than a benign polyp. It's ugly looking, it's irregular, it bleeds easily, and it can cause obvious rectal bleeding or invisible bleeding. And that brings us to the fact that colon cancer seems to be affecting people at a younger age, especially under the age of 50.
Now let's go back to the previous slide to fully explain the methods of diagnosing appendix cancer. Now, cancer of the appendix is extremely hard to diagnose because it has been classified as highly asymptomatic in the early stages. However, tests that can be done include imaging, which allows for the visible image of a tumor around the appendix, and that may include a MRI scan, a CT scan, or a PET scan, a PET scan. Now, like we saw in the video, a colonoscopy can also be used, and it is when a colonoscope is injected into your rectum and threaded out of the colon. And sometimes the endoscopist may see a tumor growing out of the appendix of the colon. Now, a biopsy can also be used, and it is actually the classic method of diagnosis for cancers, like in general. And it is when tissue is removed from a suspicious area and examined for malignant or cancerous cells. And as you can see here is a diagram of the colon, intestine, and you have the colon, and the appendix at the very end. And thank you for watching, and I hope you all have a great day. See you next week.